That clock, it is ticking for you to enroll for healthcare in the Affordable Care Act marketplace. You have until Sunday to pick your plan. To help you navigate that process and get you information on other healthcare related things and Medicare related things, we're joined by 3 experts today. We have Catherine Sevier with AARP of North Carolina, Steve Edmonds with Alliance Insurance Services, and Mark Van Arnam with Legal Aid of North Carolina, as well as the North Carolina Navigator Consortium. All right, so what we want you to do is we want you to be able to text whatever question you have, and these are anonymous questions. So the number is 336-379-5775. You get to ask your question in real time and get your question answered right here and right now. All right, so the ACA deadline, the marketplace, let's talk about that, Mark. Let's talk about when that deadline is, when they have to have all their selections done by.
Yeah, that deadline is fast approaching. The deadline to get covered is Sunday night at 11:59 p.m. Once we hit Monday at midnight, open enrollment is closed, and you will not be able to get coverage via the marketplace for the 2023 plan year. So act now and make sure that you get covered.
Okay, now there may be people that are watching tonight and they're thinking to themselves, okay, that's Sunday. I've got like a little more than 36 hours or 48 hours or so to make my decision. And it just all seems too overwhelming. I'm just going to go with my plan from last year and I think it'll be fine. Steve, what do you say about that?
So you can do that. Plans will roll over from last year, even if they're not updated. But it's always best to do an active update because a lot of things can change. Family members change, incomes change, circumstances change. So it's always best to do an active renewal when you possibly can. But if you don't and you're already signed up and you have coverage now, the plan should roll over and continue into 2023. It just may not be set up exactly like you would want it to be.
Well, the plan can change too, right? The providers can change?
Absolutely. Networks can change. You could be in a different network from what you were last year, which means you might have to use different doctors, different facilities, different hospitals, and so forth. So yeah, it's really a good idea to check on your plan. You've still got time to do it, so get the ball rolling and do that.
Okay. All right. Speaking of things that have changed, Catherine, let's talk about Medicare. Let's talk about insulin, and let's talk about how all this reimbursement stuff is going to happen.
So the good news is, because of legislation passed late last year, insulin is now capped at $35 a month for Medicare recipients who are receiving their insulin. However, the frustrating thing is all of the plans that you might have subscribed to for your drug coverage were printing their information early last year, so they didn't know that we were going to have a $35 offering. So if you don't know whether or not your plan covers your insulin, you need to do one of 2 things: either call Medicare and ask them directly, or call your SHIP program. And in North Carolina, we have a great SHIP program, and you can find it on the web at shiphelp.org, and they can help you to figure out whether or not the insulin you're taking is covered in your plan.
Okay, and so we've got insulin questions for you to be able to ask and things of that nature, ACA questions for you to be able to ask. Hey, Mark, let's talk about what kind of helps are around this weekend.
Yeah, so if you need to get marketplace coverage, either you need to renew your coverage or you're new to the marketplace, you still have a couple days to act. And navigators are here to help across North Carolina, and especially in the Triad. We have got events going on all weekend, Saturday and Sunday. They'll be walk-in friendly. You can, grab your family, or if it's just you, get in the car and come on out to the events and come in, and we can help you get signed up for coverage. You can go to ncnavigator.net, and there is a full calendar there that will show the multiple events that are happening around the Triad this weekend. Just make sure to act by Sunday again, because without that, you're out of luck.
All right, and Steve, we have a question about ACA eligibility. It says, is ACA eligibility income-based?
It is income-based, at least from the standpoint of being able to get back some government assistance. Anybody can get an ACA plan, But if you're a really high income earner, then you may not get any assistance from the government, and which means you would be paying the full premium out of your pocket. Generally, the lower your income is, the more assistance that you're going to get from the government and helping you pay those premiums. And the higher that your income is, the less assistance from the government you're going to get in paying those premiums.
Okay. This person is asking about dental plans, and I'm not sure if they're asking for Medicare or they're asking for ACA. So we'll start first with Medicare, then we'll go to ACA. Mark, if you can answer that question. So Catherine, what do we know about dental plans and waiting periods and Medicare?
Okay, so traditional Medicare does not cover dental work other than some small amounts because of a medical condition that you might need it. Some of the Medicare Advantage programs do. So if dental is something you're concerned about when you're looking for a plan, if you sign up this year for the first time, you might consider a Medicare Advantage plan, which is considered a Part C plan.
And that deals with dental. Okay, Mark, what about on the marketplace?
Yeah, there are plans, dental plans available on the marketplace. They are purchased separately from the medical plans that are on the marketplace. They work a little bit differently, but there are dental plans that are available. And I just want to piggyback real quickly on Steve's response about the cost of coverage and who would be eligible. Also, when he mentioned folks with a lower income are eligible. In North Carolina, we've not yet expanded Medicaid, so folks under 100% of federal poverty level, which is about $13,000 and some change for an individual, they're not eligible for those tax credits to help pay down their subsidy each month. So unfortunately, those folks are likely not going to find marketplace coverage affordable at this time.
Okay, this is all good information to know. We're going to talk about COBRA. We're going to talk about Part B. We're going to talk about when you can have supplemental insurance. All that is coming up after this break. These are your text questions. We're back in just a few minutes.